my aunt is a medical oncologist, a retired medical oncologist in Dallas, Texas. And so I used to go spend a few weeks each summer during college with her. She would put me with physicians in different specialties. I spent a couple days with a radiologist, a couple days with a surgeon. But it was the time I spent with her and her patients that I enjoyed most, and just the relationship she had with her patients, with their families, and the interactions they had, the appreciation they showed her for her care that resonated best with me. And so while I did learn a lot visiting those other specialties, those other fields, and have respect for all of them, it was medical oncology that I was really drawn to, and through my exposure through my aunt at that time in college. It's really been fast how this new class of drugs has gained FDA approval in so many different types of cancer. I think we always have some work to do when we sit down with a new patient that come in with a diagnosis of cancer. It's one 6-letter word, but it is representative of hundreds of different diseases that are completely unrelated. And back when the word cancer was devised, I mean, it was appropriate. The basic understanding we had of things at that time, you could lump all of these together as one diagnosis. But I think if we had it to do over again now, to assign these hundreds of diseases that are completely unrelated to one 6-letter word is really doing it a great disservice. And so there's a lot of education that goes into when you see a new patient, helping them understand that, yes, they have a diagnosis of cancer, but their uncle who died 20 years ago of a completely different cancer, his experience, his treatment, his side effects are completely unrelated to what they are going to be experiencing now. And so the immunotherapies, as you point out, are the latest advent in the treatment of cancers, and has really gained a lot of utility in many different tumor types. So here we talk about how different the cancers are from one another, and yet here's a class of drugs that can be applied to many of them. And the reason being is that many cancers have the ability to turn off the immune system. The immune system does not recognize them as foreign. The immune system sees them as wearing the same jersey that it is, and not a bad guy, right? So the cancer has a way of sort of putting its foot on the brake of the immune system. And these new drugs sort of take the foot off the brake and allow the immune system to do its thing. So you can imagine, and knowing how they work, you can imagine how they could be applicable in many different types of cancer that are completely unrelated to one another. I just look forward to meeting new people and hearing, their stories and their experiences. That's every day I get a chance to meet probably 20 new people, and there's not many jobs where you can do that. And so I think I look forward to meeting the next patient who, and having a front row seat for this, very difficult challenge they have. They put an amazing amount of trust in me and us, and to have a front row seat for them accomplishing unbelievable things, that's what makes this special, is to be able to see that up front.